Hi, in today's chat, we're going to discuss the different types of bite problems. I'm Dr. Carter Thomas with Harvey Thomas Orthodontics. When you bite down, your top and bottom teeth should fit together properly. This is called your bite. You may or may not know if you have a good or a bad bite, and you may or may not be experiencing discomfort or health problems related to your bite. But it's important for you to know about your bite because if it doesn't fit properly, this very often leads to problems with your overall health, wellness, and comfort as we get older. If you have an overbite, an underbite, or a crossbite, it's important to understand what that means. These can lead to long-term oral health problems if left untreated, but the good news is that orthodontic care can correct them. An overbite occurs when the upper teeth significantly overlap the lower teeth in a vertical up and down direction. While some overlap is ideal, too much overbite can cause issues like tooth grinding, jaw pain, difficulty eating, and the lower teeth can hit the gum tissue behind the upper teeth when you bite down too much and cause gum problems later on. An underbite, on the other hand, is not the opposite of an overbite. Instead, an underbite is where the lower teeth fit too far in front of the upper teeth. They protrude out too far in front of the upper teeth. This often causes speech problems, chewing difficulties, excess stress on the jaw, and TMJ joint problems later on. A crossbite happens when the upper teeth actually fit inside the lower teeth in a width or side-to-side direction. The upper teeth should fit over the lower teeth like a cupboard fitting a box or a baseball cap fitting on top. And when they don't, that's called a crossbite in the back. This type of crossbite in the back of your mouth can lead to uneven wear and uneven bone growth, causing facial asymmetry over time. Additionally, very often bite problems are related to the teeth and bones not lining up well, and these often are correlated with and can cause airway and breathing problems, which if left untreated long-term, airway and breathing problems can be detrimental to the overall health, wellness, and longevity. These are all super important functional and health concerns related to bite correction, but I'll add also that bite correction is correlated to cosmetics and facial beauty. When the bite is off, often the face and smile are not in balance. For example, the lower jaw can be way too far back or recessed, or the lower jaw may be too far forward, like the underbite. And neither of these is as pretty as it would be if the bite lined up properly. In conclusion, the primary reason we focus on bite correction is for functional health reasons, but a positive secondary benefit to bite correction is certainly always enhanced appearance. And who doesn't love looking better? The key to treating these bite issues is early intervention. If your bite isn't quite right, don't wait for the problems to get worse. Schedule a free consultation with us at Harvey and Thomas Orthodontics today, and let's set things straight.